hi everybody. My name is Nadej, and I am working at Urban as head of community and quality. I'm really pleased to host this webinar today around skin awareness with Mary from the Skcin.org charity that will talk to us about skin cancer and how we can, as a therapist, spot any any form of cancer that we could notice on client skin. We are the best person to actually see the client skin and obviously notice on spot that the client might not see. So I'm gonna head over to Marie, and she will start talking about skin cancer awareness. And if you have any questions, feel free to drop that into the text box so that we can pick that up at the end of this webinar. Over to you, Mary, and welcome on this webinar today.
Thank you for that introduction. Good morning, rather. I think, what time is it? It's 11 o'clock, isn't it? Just gone. Yes. So welcome, everybody. My name is Marie Tudor, and I'm the CEO of national skin cancer charity Skcin. Delighted to be here this morning because it's not often we get the opportunity to engage with therapists and people that work in this sector. So this is a great opportunity for us. A couple of objectives really while I'm here is, yes, to talk to you about skin cancer and raise awareness of skin cancer, because it is something that doesn't have a very high profile and it is overlooked. Also give you some advice about how to look after your own skin and what you should be doing to be sun safe and look out for those risks of becoming a skin cancer victim and how you can avoid that. And also talk about our mass training, which I'll move on to at the end of the presentation, which really is about the training that we develop specifically for people that you work in this sector. So sit back, relax, make sure you've got a drink. Right, to begin with the first slide, you're probably thinking, how the hell, what's that? You can't spell, are you dyslexic? The KC in our name, let me talk about the KC in our name. This has significant relevance because this relates to this person. 15 years ago, we lost someone to melanoma, which is the most deadliest form of skin cancer, and her name was Karen Clifford. So we've used her initials in our logo of our charity name. Karen was diagnosed with skin cancer in 2003. Now, the interesting backstory to this is that this was 15 years ago when nobody had PCs or Dr. Google or anything. And she was being given a treatment by her daughter that was a beauty therapist, giving mum a spray tan in the bath. So giving mum a spray tan, she noticed something that didn't look quite right on her mother's stomach, and said, Mum, that doesn't look right. It looks like a bit odd. It looks like it's been bleeding. You really should get it looked at. Mum came from a generation of people that didn't use sun creams. And if they did, it used to be olive oil or coconut oil or anything else that they could use. And she heeded her daughter's advice eventually and said, look, okay, I'll go and see a GP. GP referred her to a dermatologist, and unfortunately, she was diagnosed with melanoma, the most deadliest form of skin cancer. 15 years ago, there was no treatments available, and chemotherapy wasn't offered because it didn't work on malignant and melanoma tumours. She was offered major surgery to remove something that was the size of a 5p on her tummy that internally was the size of a melon. So major surgery she had, and at that time it was watch and wait, just go home, recover from your surgery and see what happens. Sadly, she was okay for about a year, but another year in, there was a routine blood test that showed up there was something not quite right with her blood count, and it was detected that the cancer had actually spread to other organs in her body. And she was given a diagnosis of 6 to 9 months. And she lost that battle on New Year's Eve 2006. The family were rocked to the core to think this could happen to something that people say, skin cancer, melanoma, it kills you. They were absolutely devastated. And from that day, they decided that her death was not to be in vain, and that they set up a charity in her name, hence Skcin, the name that we have. And that charity is dedicated purely to education. And there's a reason for that I'll explain further on in my presentation. But one of the myths that I'm really keen to display today is this word that it's only skin cancer. People tend to think, oh, it's only skin cancer and you simply get it cut out and that's the end of the problem. And that's not the case with melanoma. Melanoma is a deadly form of skin cancer. Yes, if it's caught early, but people tend to leave it because it doesn't give them any symptoms or any pain or distress. So they tend to leave it. And when people leave it, that is the problem, that melanoma once left can be deadly. And also people have difficult journeys with their treatments. There is non-melanoma skin cancer, which is not deadly, but still people have to have surgery. And usually this is surgery on their faces or parts of their body that's exposed. So it can cause them significant anxiety and distress. So when people say, oh, it's only skin cancer, those people that are patients will probably roll their eyes and go, if only you knew. So that's something I'm really, really keen to highlight to you. And the other thing is skin cancer doesn't really have a high profile. We've worked tirelessly for 15 years as a charity to try and raise the profile of skin cancer a lot more. So to give you some statistics, these are some background statistics. There's over 210,000 cases of non-melanoma skin cancer diagnosed every year. Now, to make that comparative to you, there's about 55,000 people that get diagnosed with breast cancer. And obviously, we all know someone that's had breast cancer. So yes, people don't die from skin cancer in a lot of cases, but these figures are still far too high. The rates of melanoma, the deadliest form, in Britain are rising faster than any other cancer. 1 in 36 UK males and 1 in 47 UK females will be diagnosed with a melanoma during their lifetime. Melanoma is now one of the biggest cancer killers in the 15 to 34 age group. Now, this is a real concern. We've got a new generation of people that are using sunbeds and a new generation of people that don't take sun safety seriously. And we're getting more and more people diagnosed earlier with, ages of 30, 35 and losing their lives in their 40s and 30s. There's 2,400 deaths from melanoma every year. So that's about 7 people a day. And the treatment for skin cancer costs the NHS an estimated £500 million a year, which is a shocking figure because most cases with melanoma, it tends to be immunotherapy, which is very, very expensive. And even with minor surgery for non-melanoma skin cancers, it's still surgery. And it all costs us an extreme amount of money and it's a burden to the NHS. But this is the most compelling fact of all, this next one. 86% of these cases are preventable, which is quite alarming to think that actually we could eradicate this disease if we all took preventative measures. So to us, it's an absolute no-brainer as a charity to dedicate ourselves to education, to educate people. Early detection does save lives. We've got significant, evidence to suggest that. And the earlier something is caught, the better the prognosis. So in simple terms, what is skin cancer? Skin cancer is an out-of-control growth of abnormal cells in the epidermis, the outer layer of the skin, and it's caused by unrepaired DNA damage that triggers mutations. These mutations lead to skin cells to multiply rapidly and form malignant tumours. So it's very, very simple what it is. What causes it is that lovely yellow thing in the sky, the sun. So in 90% of cases, skin cancer is caused by ultraviolet radiation, UVR, emitted by the sun's energy. So a nice little infographic here. There are 3 types of UVR, UVA, UVB and UVC. The UVC rays are blocked by the Earth's atmosphere, so we don't tend to talk about them, whilst UVA and UVB both reach the Earth's surface and can penetrate our skin. And these 2 rays work in different ways. So we have the UVB rays. They reach the outer layer of the skin, the epidermis, and are commonly known as the burning rays. So that's UVB. So they're the ones that burn you. And they're the primary cause of sunburn and skin cancer. So the UVA rays reach the middle layer of the skin, the dermis, and they contribute to sun damage and skin cancer and are responsible for around 80% of the visible signs of aging. So that's why people that have spent a lot of time outdoors, not necessarily in the sun, but outdoors, are usually have an aged skin. Sunburn. Cumulative sun exposure is the main cause of non-melanoma skin cancers, while sunburn plays a clear role in the development of melanoma. Sunburn at any age, but particularly in childhood or adolescent, can significantly increase our risk of developing a melanoma. Many melanoma patients will say, well, it's really strange that I've got a melanoma because I've always been really careful when I'm out in the sun and I've always used sun cream. But then it might have been something that occurred when they were an adolescent or a child, that they had sunburn as a child. And it's that's come back 20 or 30 years later to determine whether they get skin cancer or not. So damage starts with the very first sunburn and builds up over time. And the more often we burn, the greater our risk. The charity does a significant amount of work with schools and nurseries. So we have our own SunSafe Schools programme and our own SunSafe Nursery programme. So anybody that is a parent, please do get your children and babies engaged with these programmes so we can educate more people about how to keep their settings, their school settings and their nursery settings safe. Prevention is better than cure, which is something we hear all the time, but it's definitely the case with skin cancer. Now, in the 1970s, anybody that's a bit older, probably many of you are a lot younger and won't remember this, but Australia has a major problem with skin cancer. And 30 years ago, they were completely alarmed by the number of people that they were losing to melanoma. So the government stepped in and set up some prevention strategies that were instigated in schools, nurseries, and also instigated by government and also the sun cream suppliers. And they wanted something that was a public health message that would be easy to remember and could have some longevity and people remembering it. So that was called Slip, Slop, Slap. You may have heard of that. If not, that might be a first time for you. But what Skcin have done is we decided that we're going to take the lead from Australia and implement some of those rules and regulations here. So we've added two to it. So we have slip, slop, slap, slide, shade. Now, what we're trying to do with our messaging is in our behaviour is adopt some of these sun-safe messages. Now, normally in a session, I would have a bit more time and I would go through each and every one of these in a bit more detail. Today, I've not got the time, so I'm going to concentrate just probably on the sun cream element. But what we're trying to say is what we do is, as individuals, we all tend to think about sun cream and picking up a sun cream bottle when we talk about sun protection. We don't tend to think about clothing and covering up. We don't tend to always think about wearing a hat. A hell of a lot of skin cancers occur on the scalp and the ears and the neck. And we don't tend to think about sunglasses. You can get skin cancer or myeloma of the eye. And we don't always tend to think of shade. So sun safety is a range of behaviours using these measures. But today I'm just going to talk to you about sun cream because that's probably what most people think about. But I want to cover off how we talk about sun cream. People tend to jump to the conclusion about using sun cream on a warm or sunny day. And that's a big mistake that everybody makes. And what we're trying to do with all of our messaging that we've put out with all of our settings and all of our campaigns and all of our social media networks is get people to check the UV index. Many people don't even know what the UV index is. If you pop along to our website, www.skcin.org, and on the home screen, you can pop in your postcode and it will give you the UV index for your area. There are 8 UV monitoring stations around the UK. And we also have an app now, which I'll share with you later on, and you can check the UV index in there. So the UV index tells us how strong those UV rays are on a particular place on a particular day. They advise the level of risk of burning is categorised by these coloured coded triangles. So the higher the number, obviously the higher the risk of the sunburn. And the higher the level of UV rays. So 0 to 2 is what we normally see in the winter when we don't need to worry. Anything that is a 3 or a 5. So UV is not linked to whether it's a hot day and it's not linked to whether it's a sunny day. So it can still be a cloudy day and have strong UV. So our advice for sun safety is when the UV is above 3 or more, that's when you need to be thinking about your sun safe strategies and those 5 S's. One of the first things we look at is a sun cream. That's the only one I've got a chance today because of the time factor that we've got. Sun cream should be applied generously to all areas of the exposed skin. It should never be used as a single preventative measure and used with those other protection methods. If I had £1 for every time I would be advised for a recommendation on sun cream, I'd be sitting on a beach in Barbados now. I'd be a very rich woman. What the advice we give is, look, there are many types of sun cream, whether these be chemical, mineral, spray, lotion, stick, gel. And my advice to you is to find one that you like the look, feel and texture of. If I say to you, oh no, you really need to use a mineral sun cream that's really thick and white, you're not going to really want to use it and it might not be for you. So find one that you like the look, feel and texture and you're more likely to use. Sun protection factor is something that we regularly see in the shops now on all the bottles. We recommend an SPF 50. You can get 10s and 25s. We don't really particularly recommend those because they only provide a minimum protection, and there's clear clinical evidence that we don't apply sun cream correctly or in the right places or frequently enough. So if you're using a lower factor, it's not going to be as effective. So really SPF 30 is what we're looking for, and that gives you the sun protection factor against those burning rays. Now, UVA, you might be familiar with this. Boots the chemist launched a scheme about 30 years ago, a star rating scheme. This is not exclusive to Boots now. Boots are now offering a testing service to a whole range of products, and they can test the formulation. So anybody that's got a sun cream can send it in if they're a manufacturer and get that labelling on it, because this labelling is quite a powerful message now. We recommend anything that's got a formulation of a UVA 5-star or above. And this means the formulation has got a good ratio of UVA protection within it. And that's what we really aim for. Sun cream, again, it's a common mistake. People tend to sometimes apply it when they get to the beach or when they get outdoors. It should be applied 20 minutes before going outdoors. Think of it like painting a wall. One coat's never enough, so apply it again afterwards. And regardless of the instructions on the manufacturer's bottles, I know there's once a days, I know there's swim and play sun creams for 6 hours, sun cream for kiddies. These are tested in laboratory environments. They're not tested in a real life environment where you might be out swimming, sweating or toweling. So again, we just say, even if you're using those, regularly apply them every 2 hours. Now, many of you, if you have any knowledge about physiology of the body and vitamin D is absolutely vital for good health. So we're not telling people not to go in the sun. We're just asking people to strike the right balance. So some vitamin D at the right level is good for us, but obviously we don't want that overexposure to vitamin D. So it's about getting the right balance and people taking ownership of ensuring they get the right balance. Vitamin D deficiencies, people can get their vitamin D checked. Most people, their doctors may be a bit reluctant to do it because it all comes down to cost. You can get vitamin D tests done now online by submitting a blood test. For those concerned about vitamin D levels, the NICE guidelines do recommend a supplement from November through to March every year. And it's all important that you get the right level, because if you give too much vitamin D and you've not had it tested, it can be toxic. So now within food, there's good natural sources of vitamin D can be derived from a healthy diet. So things like egg yolks, fatty fish, trout, mackerel, salmon or tuna, cod liver oil. And now you're also finding it in fortified milks, juices and cereals. So if you look at food packaging now, you'll sometimes see that on there that it's got fortified with vitamin D supplements. The advice we say to people is take 20 minutes a day, early in the morning or late afternoon, with no sun protection required. And that should be adequate enough to give your skin the adequate vitamin D you need. Now, giving that advice, you need to consider, one, where you are in the UK, or whether you're overseas, and also your own skin type. If you're a Fitzpatrick type 1 and you can be outdoors 15 minutes and burn. So we normally say 20-25 minutes out in the sun, early morning, before 11 o'clock, and then probably after 3 or 4 o'clock are the times that we recommend to get 20-25 minutes of unprotected skin exposure to the sun. Early detection, as I said, is absolutely vital. So I'm going to talk to you now about early detection. Conducting a monthly skin check, you will know that with cancer now, men are advised to check their testicles, women are advised to do breast checks, smear tests, all these kind of things. We clearly advocate, Skin does, for a monthly skin check. So get to know your skin. From the tops of your head, from your scalp, checking your scalp, every lump and bump, every part of your body, even down to the soles of your feet. You can get skin cancer on the soles of your feet and in parts of the body where the sun doesn't shine. So even in your groin areas. So when I say top to bottom, I literally mean top to bottom. And obviously, if you've got a partner as well, encourage them to check your back. Moving on, I will have an app later on that I can talk to you about of how you can use an app to help do a skin check. But yeah, do that once a month. Get into the habit of when you get out of a shower, check your body all over, palms of your hands. Scalp of the head is vitally important. People don't think that you can get skin cancers in your scalp. And again, soles of the feet and the hands. And if you're concerned about anything, do see a GP. But on this element, I've got some other advice for doing a skin check. So I've talked to you about melanoma. Melanoma is the most deadly form of skin cancer, and there's two types of those, basal cell carcinomas and squamous cell carcinomas. Now, they present in different ways, and I've not got all the time today to go through how they present on your client's skin. What I do recommend is you pop along to our website, and there's lots of free information about what basal cell and squamous cell carcinomas look like. Today, due to the time factors we've got, I'm going to talk to you about melanoma, being as that is the most serious and the one that can literally be a lifesaver. Superficial spreading melanoma is by far the most common, and it accounts for about 70% of skin cancer cases that are diagnosed. They most commonly appear as a new mole or otherwise appear as an existing mole or frettle. Melanoma can appear literally anywhere on the part of the body. Now, to help detect it, there is a universal screening tool that's used. It's not just universal to the charity. This is usually used in the UK and globally as well. And this is called an ABCDE screening tool of melanoma. So to help you detect melanoma, we've got A stands for asymmetry. So we've got two images here. The image on the right is just a normal, healthy looking brown mole. The one on the left, if you were to put a mirror down the middle, it wouldn't be the same on both sides. So it is not symmetrical. So something that is not symmetrical, not the same both sides, is asymmetric. So that lesion there is clearly not the same on both sides. So that is a factor that you should look out for. B is for border, healthy mole on the right. Again, the border of that is nice and defined, all clear and all even. The one on the left is irregular, it's ragged, almost looks like a map, it's blurred, and it's got undefined edges. So B is for border. That's something else that you need to look out for. Oops, I've gone back there. I don't know if I can go back. I don't think I can go back yet. Colour. C is for colour. So many people have lots of moles. Some people have hundreds of moles all over their bodies, and anybody that sees people undressed will see this. That's a normal healthy mole. That one on the left, you can see it's got a dark pigmentation to it, where it's darker brown. But this darker pigment can also be red, blue, or black. Or you get some colorations where it's almost pearlescent. So the colour is a vital sign that something may not be right with a skin lesion or a mole. And D is for diameter. You can't tell from these pictures because I've not got a ruler to measure. But what we normally say is a normal round mole, if it's bigger than 6 millimeters, that is a sign that actually something should be looked at. Anything that's got a diameter bigger than 6 millimeters. If you were to measure the lesion on the left here, that looks like it's spreading and growing and looks like it's bigger than 6 millimeters. Within our education packs, we provide you with mole rulers as well, so you can get these out and use them with patients. And E is probably the most important out of all the factors, which stands for evolving. So something that is changing. So if you're seeing your clients really regularly, something that's changed over a period of time, and that could be something that's itching, bleeding, looks like it's growing, changing colour. So all those kind of factors, and this is probably one of the most important, and that's why you're in a perfect position to do that. So that's your take action checklist, something that gets bigger, changes in shape, something that changes colour, becomes elevated, firm to the touch and is growing, starts to itch, looks like it's behaving differently to the rest of the other moles, or is evolving in any way where it's changing its symmetry or its surface characteristics or symptoms. So that's your learning part for today. A lot to take in from what I've just said. But what I'm really super proud to share with you today is our app. We launched an app 4 weeks ago, and we did a fundraiser in May. Absolutely delighted with some fundraising that we did. And we are quite a small charity. There is only a very small team here at Skcin, but we're very focused on giving back and how we can reach more people. And we know nowadays with people having mobile phones, this is the way forward. So we've developed a free Skcin app, an educational self-management mobile application that's been developed to empower individuals of all skin types to learn more and take charge of their own skin health. It has no artificial intelligence in it. So artificial intelligence, there are apps out there nowadays that can tell you whether they can detect skin cancer, which for us, we're a little bit concerned about because we don't believe the technology and the clinical evidence is really there to back that up yet. This probably will be one for the future. But at the moment, we feel it's more about giving people education and how to know what to look out for and giving the tools to make some decisions about their own skin health. So this app is completely free, and I'm hugely proud to launch this. And we need as much help as we can with you downloading it and also your clients downloading it. The various elements in there, so we talk about prevention and about sun safety, about sun cream, about the use of sunbeds and not to use sunbeds. We've got a risk assessor in there so people can assess their own personal risk of getting skin cancer. We've got an element on skin checking. We've got an element on early diagnosis. We've got a section on early detection and what to look out for. We have got a UV index forecast in there, which is free for 14 days. And after that, you do have to pay a £5 or $4.99, a $4.99 fee for the year, which is nothing really. We only are passing that charge on because that's what we get charged for the satellite links for the GPS for people's phones. But we think a £5 for the year is nothing. So we hope you enjoy that. And it's simply, you don't even have to go to the App Store. And we're trying to get it on the App Store, but the App Store want to charge us to put it on there. So as a charity, we're trying to find solutions around that. So if anybody's got a phone and wants to download it now, you just simply search on your web browser, whether it be Safari, Chrome, or whatever you use, put in www.app.skcin.org and you can download the app. And then when you've opened the web, you can save it to your home screen and it will save like a little icon. And that's what we've done. So hopefully you can download that and you can start sharing that and using all the information that's on there to help yourself, your own family and friends, and your own clients. The last few minutes, I want to talk about MASS. MASS is a training program we launched in 2018, taking us back to our roots that it was a beautician that diagnosed Karen's skin cancer 15 years ago. We developed an online course. Everything this last 5 years has become digital, and we can reach a lot more people by having online courses. So in 2018, we developed an online course called MASS, Melanoma and Skin Cancer Early Detection. When we launched it, we knew we could reach more people this way, but we never exactly knew how many people we could reach. And this has absolutely blown us away. So what is MASS? It stands for Melanoma and Skin Cancer Early Detection, and it's an educational accreditation program for anybody in the hair, health, beauty industry sectors. The course is an online course, and the course you can find by putting in www.mass.uk. And the e-course is designed to reinforce key messaging about different elements of skin cancer early detection and the risks of getting skin cancer. So the course, when we initially launched it, we were oversubscribed. Over 1,000 people signed up in over 3 weeks. So we're absolutely blown away by that. We have now trained over 8,500 people. And now we've had to introduce a charge because we incur costs for sending out training manuals and guides. So that cost is £20. And we think this is absolutely nothing as for terms of a training course to be able to save someone's lives and giving you a skill, not only with your own clients, but with your own family and friends. The course is £20. It's been approved by the Federation of Holistic Therapists. It's been reviewed professionally by the British Association of Dermatologists. And also for anybody that has got a healthcare background, we developed MASS Pro. MASS Pro is for anybody that's in a health background, a clinical background, that may have more experience, that wants more in-depth insight into the client pathway of when someone gets diagnosed. So this was brought about because nurses normally get no formal training in skin cancer, which absolutely alarmed us. And what alarmed us even more was GPs get very little training in skin cancer surveillance. They're lucky if they get 3 weeks on dermatology. So, you know, we've put this tool out there to help GPs as well. And we've trained over 1,000 people that have been nurses, GPs, physios, chiropractors, whatever it might be. So there's two options there for you. It's entirely up to you which one you want to take. £20, people can start off on the £20 one and we'll give them an upgrade code so they can go to the £40 one, or you might just want to go with the 20 and think that's adequately enough for you. The course takes you about an hour to complete online, and within 3 to 5 days of registering online, you'll get dispatched by second class post your training materials. Prevention and early detection does save lives. We have had literally hundreds and hundreds of people come back to us to say, oh my God, I've done your training and I've picked something up on my patient or my client. And those stories we're absolutely passionate about getting them out in the media, because this raises awareness of skin cancer, and it also raises awareness of the vital role that anybody that sees a person's skin close up and personal is doing. I have very regular meetings with consultant dermatologists, and they are saying to me, everybody that's walking through my door has been referred by their barber, by their hairdresser, by their massage therapist, by their whoever it might be. And this is so powerful, and you as an industry sector needs to be applauded and celebrated for this work and how powerful this role can really be. This last slide is to just say, if you're interested in our work and our education, please do follow us on social media at Skcin Charity. That's our handle there. We have a very proactive account on Facebook, Instagram and Twitter, and probably 95% of our posts are all educational based. So if you're looking for content for your own social media, you're looking for something interesting to share, please do follow us on social media. Now, that's me just about done. Whether I've kept time or not, I don't know. I'll probably get a ticking off now. So I hope you've enjoyed it. I hope you've learned something. And if anybody's got any questions, please do shout out and I'll try and answer them the best I can.
Absolutely. Thank you so much, Mary. That was really informative. We actually have one question so far, and I have another one to ask after that. So the first question is, am I correct in thinking some facial moisturizer have SPF 50 included?
Yeah, it's lots and lots of cosmetics have SPF in them, whether it be makeup, whether it be moisturizer or whatever. But if the product's primary purpose is not a sun cream, it's not fit for purpose really. So yeah, that's fine, carry on using that, but please, if you can, use an SPF as well. And what's nice about SPF now is a lot of females particularly have recognized that it's becoming the new in vogue because it's stopping the signs of aging. So people are taking the two aspects, thinking, oh, this is not so much about sun protection, this is about the UVA rays causing aging. So yeah, use an SPF on top of your moisturizer for that sole purpose if you're outdoors, during the day. Definitely.
Thank you very much. And the next question is about how fast is spreading a skin cancer?
Skin cancer, we've had a 56% growth in the past 10 years. Those figures that I mentioned, 210, I've just got a new report in this week. It's actually 249,000 cases. So it's completely heading in the wrong direction. When Karen was diagnosed 15 years ago, it was heading in the wrong direction then, and the statistics were underplayed. And part of the reason skin cancer is underplayed is that many skin cancers, if they're non-melanoma, are simply removed and they are not captured by the National Cancer Registries. So one patient may have 5 or 6 surgeries to have skin cancers removed, but that patient is only classed as one patient. It's not classed as the number of cancer cases they've had on their skin. So it's totally underplayed. So we've known this has been a problem for a number of years. So the National Cancer Registries are just starting to collate those figures more accurately. And this is why it's alarming, because we're the charity that's been flying the flag for this for a long time. And people are only just starting to wake up to say, oh my God, this is really, really becoming a problem. So yes, it is a problem. 56% growth. It's going in completely the wrong direction. And the thing is, we go back to that statistic again, 86% preventable. So the only people that can do something about these statistics going in the wrong direction is you, me, and every single one of us, and our family and friends and our clients, by being more educated.
And do you know how long somebody has how much time has somebody to act and take an appointment with the GP or dermatologist as soon as they realize something is on their skin?
As soon as you think there's something wrong, we've got so much education out there. There's lots of free information on our website. There's loads of free information in the app. If you read that information, look at your skin and feel there is a problem, arm yourself with that information, take it to a GP and say, I've got a lesion, I'm not happy about it, please we have a look at it about it. But please bear in mind what I said earlier. We have some GPs that are really, really good, and we have some GPs that do specialise in dermatology. They're called a gypsy, a GP with a special interest. But we have some GPs that see so many skin conditions, they're a bit dismissive. They might think it's a rash or it's eczema or it's psoriasis. If you're not happy and you feel unconvinced, you can ask for a second opinion, go and see another GP. Or if you want, go and see a consultant dermatologist yourself. Now, a consultant dermatologist will charge, but some people just want the peace of mind to go and see a dermatologist. Some people in America particularly have a skin check once a year. They go and see a dermatologist once a year and have a full body skin check. And that's a solution. And also now there is a company that we've partnered with called My Skin Doctor. So My Skin Doctor is an app, and what they do is if you can't get in to see a GP or the GP is really difficult to get hold of, you can take a photograph of your image, send it through to My Skin Doctor. They obviously charge, but I think the fee is only £75. And within 3 days, they'll get back to you with a diagnosis and a treatment plan. So for a lot of people, paying and having that peace of mind is more beneficial. So, you know, do bear that in mind. But again, hammer your GP if you don't get a solution that you're looking for, because if you know there's something that might be wrong, just get it, you know, get the GP. And if they're not happy, you know, just stress to them what you're worried about, because GPs do get a lot of people that are worried. Well, they worry about everything. And I think sometimes it's hard for the GP to determine what is a genuine concern. And that's why if you go armed with the facts and the education, use our app, use our booklets, you're armed with that information. It's better, our view, to be safe than sorry.
Brilliant. That was great. Thank you very much, Mary. It doesn't look like that we have any further questions from the community. I want to thank you very much. And I guess from everybody that joined today, it was extremely informative, really very well explained as well. And as a therapist myself, as well as much as other people joining today, I think that was a great awareness. Like even though some were probably already very much aware, it's great to have this reminder, and that makes me want to just go on your website and read even more. So thank you so much.
Definitely get people to do the training. That is, I mean,
absolutely.
We've done it for £20. Yeah. The reward you get back from that, when a client comes back to say, oh my God, I took your advice, and look, that will be a client for life. So that's client retention, to think that you've gone out of your way to look after them. So yeah, complete the training, go on our website for £20. It's nothing really to think that you're just donating £20 to a charity, really, but you're also arming yourself with a life-saving skill that can help your own family and friends. So yeah, I've enjoyed it. Thank you for listening, everybody.
Thank you very much again. I guess this is the right time to wrap up now, and we will send more information to our community about your training and further webinar that we will organize with you in the future. Thank you very much, Mary. Have a lovely day, everybody.
Thank you.